Good morning, this is Dr. Timothy Scott Beck coming to you with my weekly video update. And I know I changed from daily to weekly. I do feel a little detached from everybody, however, it does seem to be appropriate, and hopefully I can give you some information that'll be useful today and talk about some things going on here and get you help. First of all, a lot of good things are going on around here in the office. Our new provider is working out well, Hannah. Our new x-ray machine is doing really good, and we're constantly working to try to improve ourselves and to improve our processes around here so that we can give you the highest level of care that we possibly can. And we want to listen to you, and we want to help you and help you move in the right direction when it comes to your healthcare needs. So use us for that, okay? We sometimes people say, Dr. Beck, I hate to call and bother you. And I tell them, I said, look, if people quit calling and bothering me, then I don't have a job anymore. And I really like this job, and I like to feed my family. There's something about it. It's wonderful. Okay, so let's get down to business and talk about things. First of all, the COVID-19. It does look like it is away from this area at this time. If you can get past all the war talk on the news sites, you can see where they're still kind of talking about the COVID, but it has dropped off, and it looks like other countries are having problems, but we're not. So we'll just have to keep our eye on that, and Lord help us, I don't want another wave to come through, but if we do, I'll be here for you, and we'll just have to figure out how to fight it out this next time. And I tell you, the anxiety and the psychological trauma that we've all experienced over these last few years, don't underestimate how that's been. We have really had to contemplate a lot of things, and we forget how scary this thing was going into it, and how much it's affected our lives. And lots of people have not got back to normal after this. Either they've got severe anxiety or they've got long haulers COVID syndrome. Just like I had a mortician who was talking to me a couple of weeks ago, and she's like, I remember when our whole morgue was full of people, and it was really scary, and we didn't know what to do. And I forgot about how it was, and when we were making decisions, you didn't know. I mean, we were concerned that I was going to have to live in a camper out here behind the office just to keep taking care of people because I didn't want to hurt my family. There's all kind of things we went through, and I'm just glad we're kind of on a better place now. But thinking back, it was tough. Let's talk about one thing that's going on. I wanted a business thing. People are calling some of my patients, and they are requesting information about Medicare and things like that. And they say that there's somebody in my office, and it looks like the caller ID is popping up with my office name on it. If you get a call from my office and it's my office name and it's somebody that you don't recognize, would you please contact us? Because every time this happens, we contact the police. And I don't know how often it's happening, okay, but if you can get some information while you're on there, who's calling, why they're calling, what they say their name is, any information like that, and if you could pass it on to us so we can pass it on to law enforcement. The main thing that I'm concerned about is it pops up with my caller ID on it, okay? And we do have a pretty robust communication system here in the office. I know people get text and emails and things like that. So just be mindful that sometimes people are faking us or somebody. And if you have any question, don't give them any information, and call the office and talk to us and see if that was legitimate or not, and we'll go from there with it. So just want to give y'all a heads up. Another issue that is kind of plaguing the office a little bit, and it's making people upset with me, and I understand why they get upset, but I also understand that we've come up with a remedy, and if you do not follow the remedy for it, you'll get upset, and we have to just remind you. So what it is, it has to do with controlled substances. So the scenarios that we're seeing playing out are somebody, let's say, has an appointment on Tuesday, and they come in and they don't bring their meds, but they're on a controlled substance that we have to monitor. They might come in on Tuesday and be seen and everything's just fine, and they finish their appointment, and then Thursday they call us and they say, you didn't refill my controlled substance. And we say, well, you've got to have another appointment. And then that's when they get upset. And we and what it is if you bring your meds in and you let us know what you need refills on, we'll take care of that for you right there on the spot. Matter of fact, all the nurses are commanded when a patient comes in for an appointment, they bring their meds, you go through each med, and if you see that they need refills or we have parameters, we will automatically refill those, including the controlled substances if that's what's going on. Okay, we are going to mandate that if you get a refill on a controlled substance, for most people, you're going to have a visit. There is some arrangements we made, but those are very special arrangements. Otherwise, bring your controlled substances in their bottles, okay, because we're supposed to be counting pills and doing all kind of stuff with those things. If you don't bring those in, okay, and you do not get those refilled at your regularly scheduled appointment, and we don't do the paperwork and the stuff that we need to do to surveil it, to watch over what's going on, then you expect another visit. And I'm so sorry, but this is kind of the way we've got it set up, and we're going to stick to it, okay, because we're all about safety. And that's really the big issue, is safety and monitoring. Safety from, hey, let's make sure we're doing this right, make sure you're not on the wrong medicine or too much or something like that, or you have a combination that's not conducive. But also government, federal and state oversight, okay? These people are serious about this stuff, and all our, it's my job, it's my license to appreciate the need or the not need for these medications, and to prescribe them professionally and do it in a responsible manner. The responsibility of that falls on me, and the state and the federal government have kind of give us parameters of what they consider to be responsible prescribing. So I'm going to follow them. I don't have a choice. You don't have a choice. Well, you have a choice. You don't have to follow the guidelines, but I cannot provide you with the medicines. And I apologize for being that way, but it's just that simple. This is one of the biggest, deadliest issues in our country. It's killed more people than COVID, okay, or wars. And I know it's real, and I take it serious, and you should take it serious. And if you come in and you're making up excuses or don't want to comply or don't want to do things, I'm sorry, but that is what the people who are doing things incorrectly do to us all the time. And that is how we pick up on people being non-compliant with their meds, is they don't want to do a drug screen, or they don't want to come in, or they don't want to bring their meds. Anything like that is going to look like something abnormal is going on. So please help us with that. We got you. We'll help you. You just got to meet us at the table on that stuff, okay? All right. So last but not least, I'm going to talk today a little bit about these annual wellness visits, and I'm probably going to do this every week, because as long as I am saving people's lives, if I'm changing people's history with doing something right, I'm going to keep doing it right, and that's the annual wellness visits. I want to save people's lives. Like, that is my highest performance indicator. Am I doing that? Am I changing people's lives? And we know that if we do the annual wellness visits correctly, that there will be a great benefit for that for those people in the future. Not everybody, and you never know what I prevent from happening, right? Because it didn't happen. But the annual wellness visits is a good time for you to come in and not take care of your problems. It's to take care of all the other stuff that should be done or looked at for your age and your sex and all the different things. So if you haven't had your annual wellness visit, would you please call us and let us know? Or if you come in and make a visit and you're like, I haven't had my wellness visit done, well, we'll get you set up for that wellness, and we'll get you taken care of as soon as possible. Again, I'm a big fan of it because it saves people's lives. All righty. Well, I've talked your ear off today, and I appreciate you listening. We're doing okay, and we hope you are too. We've got room for you this week if you need to be seen. And just give us a call at 706-782-0016, or go to our website, drtsbeck.com, and you can text us, you can request a new appointment, or you can hit the call button and it'll call it in for you. Anyway, we got multiple ways you can get a hold of us, and we want to get you taken care of as soon as humanly possible if you're sick. All right. Thank you so much for listening. Have a great week.